Guys, I'm Dr. Christopher Timms. The Dungeons and Dragons movie is absolutely smashing it at cinemas this month. Today I wanted to talk about a principle I drew from Dungeons and Dragons that affects my daily practice as a GP or family physician. In Dungeons and Dragons, there's a class called the Paladin, which is somewhat of a tank fighter slash multi-class healer. In Dungeons and Dragons, this class has an ability called Lay on Hands. And Lay on Hands is an ability that lets them heal someone. However, they've got to be able to have physical contact with them. And there's only so many people they can heal in a day. They have a finite pool to draw from while they heal someone. How does that relate to my daily work as a family doctor? In general practice, it's often therapeutic to what's called lay on hands or physically examine the patient. It's reassuring, it helps you determine what's going on, and I find my patients are more reassured if I have laid on hands and done a physical examination than if I've just taken a history over telehealth. It's not always needed, but it is a useful tool. Now, the other interesting thing about a paladin is that they draw their strength from an oath. And it's very interesting because all doctors observe the Hippocratic Oath, and that's one of the things we also draw strength from. So it's a useful principle. The Paladin has an ability called Lay on Hands. Now, it's interesting that the Paladin can only heal a certain amount of points per day, because as a doctor, there's a theoretical limit to how many patients you can help out or serve each day. Each patient you see requires a certain level of mental effort, as well as offering a certain degree of compassion or empathy. And during the day, there may be only so many of those interventions you can offer. Anyway, that's a principle that I drew from Dungeons and Dragons that helps me every day as a family doctor.